uniform and gradual and mirroring the contraction, or after the contraction, or are they abrupt? And as you can see there, those contractions are variables, they are abrupt. So a variable is caused by cord compression. So your goal in resuscitating this baby is to get the pressure off of the cord, and you would achieve that by maternal repositioning. So all of those could be appropriate, but it's just like boards. What's your number one best answer? And that would be C, maternal repositioning. So that's the way you got to think about it, because all of those are right in varying degrees, but your first line is C, maternal repositioning. Okay, this patient is complete in pushing. Based on the tracing above, what initial intrauterine resuscitation measures would be appropriate? Well, if she's complete in pushing, what's the chances you're going to be able to put an amnio infusion in? Like 0 to none. Would you want to IV fluid bolus? Sure, that would be great, and you should do that. And I know you all do, and you do all of these things all at once because you're great nurses. But the answer they're looking for, and again, it's just like boards, what are they looking for? They're looking for answer C, their modified pushing efforts. You need to try to decrease a little bit of that pushing effort, have them push every other or every third. So think about what they are looking for, and so that might help guide you in that. So there's your baby yawning. Hopefully you guys aren't yawning. You're paying attention. This concludes the end of this review. And just a couple of things about the test that I wanted to talk about. There will be 125 questions. 110 are counted for scoring. There's 15 embedded pre-test questions not counted. So in other words, like I said, if there's a question on there that seems really funky, it might be an embedded question, meaning a tryout question that they're going to use for future testing, and they're just seeing how people score on it to see if it's a good question. Do your best to answer that, and just hopefully keep in mind that it won't count against you. So there'll be 15 of them within that 125 that are going to be thrown out. So if that makes you feel better, that's the way you can think about it. Each question has a stem and 3 alternative answers, so meaning they're looking for one certain thing. The answers are listed randomly, meaning, well, not really randomly, they're alphabetized, so you can't, I guess they figured that some people have a system down for A's, B's, and C's and all of that. So you have no penalty for guessing. It tests both basic knowledge and application of knowledge. So that goes back to looking at your strips and knowing where those decels and things are coming from and making your interventions appropriate to what's happening. So you choose your best answer for that. EFM tracings are set at speed 3 centimeters per minute, which is standard in our country. I think they also use this test in other countries where their paper speed is different, but it's just standard for us. And you're allowed 2 hours to complete the exam. So I'm hoping that you feel a little bit better about the material. And there's also that NCC guide that goes through each strip and what interventions are, and then it has a table of all the medications and what they do to the heart rate, and I put those in your mailboxes. So I suggest that you study those too and memorize the little circle, like the Venn diagram, the little circles of the strips. And if you have that down, that'll take you a long way to passing the test. This concludes the review number 2, and I'm going to post the video and guide to review number 3, and you can watch that also.